People's Padma on Akashvani. Good evening and welcome to our special program People's Padma on Akashvani. Today we bring you an inspiring story from the field of traditional medicine. Dr. Punyamurthy Natesan, a distinguished veterinary pharmacologist from Tamil Nadu, has been selected to be conferred with one of the country's highest civilian honors, the Padma Shri Award. Through years of dedicated work in ethno-veterinary medicine, he has focused on delivering accessible, affordable, and sustainable healthcare solutions for livestock. Speaking to Akashvani News on the importance of accessible and affordable livestock healthcare, Dr. Punyamurthy Natesan highlighted how traditional Siddha-based ethno-veterinary medicine has consistently delivered effective and positive outcomes for farmers.
I've been working for the last 25 years on traditional Siddha-based ethno-veterinary medicine to counteract some of the issues affecting the livestock production in India. First thing is accessibility of these medicinal resources and services for the farm gate level, especially in India, farmers having very low number of cattle, 2, 3 in number. So that is one main reason. The second is affordability of healthcare systems and services. Third one is what is the outcome of these medical interventions. So a positive outcome is very essential for identifying a healthcare intervention as useful. If only there is positive outcome, we can call it as a successful medical intervention. So these issues were the first tenets I actually tested for the traditional system, the ethno-veterinary medicine. In the course of about 10 years, I realized the traditional Siddha-based ethno-veterinary medicine is fulfilling all these criteria very effectively. Not only that, this ethno-veterinary medicine is also preventive, curative and reparative. For example, if you take mastitis, something has been done earlier and there is a disturbance in the milk producing apparatus in the udder, the tissues, and they are showing some fibrosed nature, nothing would be done normally. But aloe vera, turmeric and chunna, the combination which we call as the magnum opus of our formulations, which is being promoted and disseminated by National Dairy Development Board, Government of India, which is also featuring in the standard veterinary treatment guidelines for veterinarians in the field, and also in the strategic document for prevention and control of mastitis. So this particular recipe comprising of aloe vera, turmeric and chunna, standardizing the SOPs related to that, about 250 grams of whole aloe vera, 50 grams of turmeric and 15 to 20 grams of chunna powder. So makes a very clear case which can be used to prevent mastitis, which can be used as a therapy in the outbreak of mastitis in the individual animal, and also the fibrosed condition can be brought back to production the maximum possible. So this is not prevalent with any other system. The second point which I consider very, very crucial is that this particular knowledge system was not just taken up like that. By understanding the modern pathobiology of the disease, the various outcome of this disease in the individual animal, by applying this understanding of the Siddha-based ethno-veterinary medicine to bring about not only a cure in the real sense, but also maintaining the reproductive status of the animal, which is very crucial in livestock production.
Emphasizing the broader impact of traditional practices on both animal and human health, Dr. Natesan explained how ethno-veterinary medicine promotes chemical-free livestock products and supports sustainable and natural farming systems.
Health must be sustainable and productive in nature and keep the animal healthy. So the first point is the ethno-veterinary medicine does is it brings about the milk, meat and eggs from livestock industry completely free from chemical drug residues. So we use standalone method of using only traditional herbal recipes combining with no other chemical. So that is fine when we use the milk, meat, and eggs for the food basket, which is completely free from the chemical residues. That's possible. But that is not the only advantage. Another major contribution of ethno-veterinary medicine is the dung, urine from the cattle, pellets and droppings from the sheep and goats and poultry are also completely free from drug residues, so that the inputs are going into the natural or organic farming methods. So, which I consider as the first important step into natural farming and One Health outcome.
Explaining the concept of One Health and its dimensions, Dr. Punyamurthy Natesan highlighted how ethno-veterinary medicine plays a crucial role in promoting environmental sustainability and holistic health outcomes.
So, what is One Health? One Health is soil health, plant health, animal health, human health, in toto the environmental health. So, if you keep the animals free from drug residues for their maintenance in maintaining health and production, you not only produce milk, meat, and eggs free from chemical residues, but also make dung, urine, other droppings from the animals completely free from these chemical residues, which makes the organic farming very effective, and that is the first step towards One Health. So, in that respect, I consider ethno-veterinary medicine is an important and first step towards One Health initiative.
Dr. Punyamurthy Natesan also pointed out the available evidence demonstrating effectiveness and reliability of ethno-veterinary medicine.
The next very important contribution of ethno-veterinary medicine, which is tested scientifically and proven with a very large number of data, 12.5 lakh animals through the NDDB work, proves beyond doubt that ethno-veterinary medicine is not only evidence-based and a very, very consistent tool in maintaining very effective livestock production, which is sustainable, and maintain livelihoods as an affordable healthcare system.
Highlighting the wider relevance of ethno-veterinary medicine in addressing antimicrobial resistance and promoting sustainable agriculture within the One Health framework, Dr. Punyamurthy Natesan also underscored its scientific validation, large-scale adoption, and effective dissemination among farmers.
So, if you see this from this perspective, the antimicrobial resistance is an important area which is being a worrisome issue across the globe. Nobody is able to deal with that as an alternative. So, ethno-veterinary medicine provides a very clear alternative to unnecessary dependence on antimicrobials. It is to be conserved for future. So, antimicrobial stewardship is achieved through ethno-veterinary medicine. So, I think these are all some of the essential components of this and ethno-veterinary medicine, which is inherently present in that. So, I had the opportunity as a professor of pharmacology and toxicology from TANUVAS with the able support from TDU and many other organizations, which I should say that All India Radio Trichy had the opportunity to disseminate the information on EVM for a very, very long period starting from 2002, and they still continue to do. Reaching the unreached at the farm gate level is very essential for them to provide. So, All India Radio Trichy has done a service in that. Doordarshan also covered, and they regularly feature this. So, many other media partners in this community development, they are also part of it. So, as an institution, FRLHT, TDU Bangalore, CIKS, MSSRF, BEES, Gopals, SEVA, Antra, NLF Netherlands and NLF India, they are all very important collaborators for dissemination of my work, which has given an enormous opportunity to generate data which proves beyond doubt that ethno-veterinary medicine is an evidence-based medicine which can go stand alone in handling infectious, metabolic, under other musculoskeletal system diseases which cripple the livestock in terms of its production and livability. So, farmers in India, they are dependent on livestock for their livelihoods. To keep all the population remain in the villages to sustain food production through agriculture and animal husbandry is our motto, and also make the soil fertile, the environment green. So, ethno-veterinary medicine provides a very right combination of these things based on the traditional Siddha knowledge, that I have been happy to handle such a robust knowledge system. The Siddha Ayurveda understanding of the traditional knowledge is very crucial for the exploitation of this knowledge system, so to say. So the farmers can easily learn this, and it's an important transfer of technology which could be scaled up across the country. And as a whole, that ethno-veterinary medicine is playing a pivotal role in maintaining the soil microbiome balance, thereby maintaining a balance of all the other microbes in the different systems of the biosphere, like plants, animals, human beings, water bodies, atmosphere, you name it. So this is an important and first step towards achieving One Health. So One Health is our motto in the villages through agriculture, which is organic and natural, and also livestock production, which is organic and natural. Ethno-veterinary medicine is again an important step towards making One Health a reality, with the increasing incidence of many metabolic diseases like obesity and lifestyle disorders in the Indian population, that we have to make sure we keep the soil fertile and we keep the animals free from chemical residues in terms of their output, not only in milk, meat and eggs, but also urine and dung. So in every respect, ethno-veterinary medicine provides an excellent opportunity to keep One Health a possibility. The major question being asked about traditional knowledge is whether it is scientifically based. I would answer it very cleanly that we, through ICR network, Tamil Nadu State Part 2 scheme, and also later under TANI scheme, a huge sum of money has been funded for this. And to make a clear statement, we did all the preliminary work from documentation, phytochemical analysis, literature survey, and also in vitro, in vivo study. Recently, through college in Pala, St. Thomas College in Pala, and also Indian Institute of Science in Bangalore, funded by the National Dairy Development Board, we have done, as I mentioned to you, this aloe vera, turmeric and chunam combination and ethno-veterinary formulation for mastitis was thoroughly analyzed for in vivo and in vitro studies. One of the papers has been recently accepted and published by the Elsevier journal, Microbial Pathogenesis, in its December 2025 issue. So the acceptance by all the stakeholders, see, the farmers, they are the first users of this knowledge, and the field veterinarians, the academia, the various veterinary institutes, the field doctors, and the policy makers and government bureaucrats have all believed in this system because of the enormous success we are able to show in this system. So we as Indians can be proud that our knowledge system stand the test of even the strictest so-called scientific fundamentals to prove that this knowledge system is robust, effective, scalable, and can address the very serious issues like antimicrobial resistance and provide clean food and also help produce clean food. I am very thankful to Government of India for considering as an individual myself and also recognizing the concept of Siddha-based ethno-veterinary medicine for the award of Padma Shri for the year 2026. While thanking them profoundly, I also must add quickly that this is not only an recognition for the individual and the team of people who have contributed to this, but also a great responsibility to keep this knowledge fully and thoroughly analyzed for many other diseases for which there is a need, and also take it to every nook and corner of India so that the farmers in India will keep not only their animals' product like milk, meat and eggs clean, but also their environment clean, so that India becoming a organic hub in food production is a reality. So this is the responsibility I feel that should involve in educating the veterinarians, the farmers and all the stakeholders to believe that Indian knowledge system is robust, effective and will help in taking it forward for the future. So this is a very important thing, that not only we give our future generations a very fertile soil as a legacy, but also the robust systems which they can continue to grow. There is a term called medicinal agroecology. What it means by that is that we keep the environment very safe, because there is always a need for growing more and more food. that food should be made ecologically safer way through conservation agriculture, through conserving all the resources. The insects are dying because of the chemical usage on a day-to-day domestic as well as industrial as well as environmental pollutants. And there are endocrine disruptors which affect the reproductive ability of all the species connected. So insect crisis is another area where ethno-veterinary medicine can definitely help those who are working in that area, that there is a knowledge system which is robust, which will keep the entire atmosphere with diverse beings, which will help in pollination, maintain soil fertility, and also help to sustain the food production forever, because we need to produce more and more food with less and less land. So a sustainable way of food production is very important. Ethno-veterinary medicine shows the way. So this Padma Shri award for a person working on ethno-veterinary medicine is a reminder that India is confident of its roots and its robust knowledge system, and we have a message to the world that we have enough things to amalgamate all our knowledge systems, seamlessly fusing with the modern advancements. We don't replace one with other. And when we talk about the ethno-veterinary medicine, we don't talk about the superiority of one system with other. We are talking about the diversity of applications in various situations. When there is a surgery, we do the surgery with the utmost care. When there is a medical intervention, we use the ethno-veterinary medicine effectively so that there is no need for any other chemical intervention. We conserve antibiotics for the future. We use it very sparingly and conserve it for future. This is a very important message. Ethno-veterinary medicine does not replace anything. It helps to keep the entire stock of things with the modernity in seamless fusion with the understanding, and connecting the ancient roots with the modern understanding is the beauty of this knowledge system. For the last 25 years, I have really enjoyed making this happen, and I will continue to do this to carry to every nook and corner of the Indian farmers at the farm gate level. So we provide the last mile connectivity to the unreached, so that over phone as a telemedicine, this can help prevent the disease, treat the animal, and also recover their productive status, so that India will prosper in India and showing way for the entire world. When somebody asks, how did you get into this type of work? So my visit in 1997 as a AHRTP fellow to US and Canada to learn how they teach pharmacology and toxicology in the North American universities. So I had a feeling that they are not working for our problems. So I thought we should have a solution for our own problems, don't depend on others. But I didn't know where to start. So I attended a meeting by the Danida program conducted by the Animal Husbandry Department, the Government of Tamil Nadu. So I had the meeting with the traditional healers. So I realized there is a potential knowledge system. So when I started working, many people doubted why a full-fledged pharmacology professor should get into a knowledge system which is not having any clear boundaries. But I realized very soon that they are having a very, very robust knowledge system. So when I started working, there were few awards coming on the way. So one of the first things came from Nammalvar Foundation. The next was Tamil Nadu State Council in Science and Technology as the Tamil Nadu Scientist Award. And then Indian Society of Pharmacology and Toxicology, Indian Society of Ethnopharmacology, Indian Society for Buffalo Development, Indian Veterinary Association. Many things followed, realizing the need for such system. I always think these awards are the recognition for an important knowledge system. So the 2026 Padma Shri announcement is a pinnacle of glory for the system, and I am really delighted. 25 years back when I started, this was considered as a very out of margin idea or concept. Now ethno-veterinary medicine is considered very much a robust and also a dependable knowledge system. So I am really thankful to the Government of India for recognizing a veterinarian working on ethno-veterinary medicine, which will in the long run help make One Health a reality.
Expressing his gratitude on being selected for the Padma Shri Award, Dr. Punyamurthy Natesan said that India's traditional knowledge systems have the potential to address both local needs and global challenges.
So I think the Government of India selecting me for the honor of Padma Shri for the year 2026 stems from the fact that Indian traditional knowledge system on health is not only a robust system but also can show the way for the entire world. And we say normally we think globally and act locally, and this ethnoveterinary medicine is not only solves the local problems but also help to address an important global issue like antimicrobial resistance. So I thank once again all those who have helped me to achieve this. Thank you.
With that, we come to the end of the special program People's Padma on Akashvani, wherein we shared the work of Dr. Punyamurthy Natesan. We will continue to bring more such inspiring stories. Thank you, listeners, for joining us, and stay tuned to Akashvani. You can send your feedback on this program to us via email. The email ID is podcast.airnews@gmail.com. You can also listen to this program on our app, News on AIR, and our YouTube channel, News on AIR Official. People's Padma on Akashvani.